he is here to help us understand things about ocular allergies. So I wouldn't want to talk so much. I would rather prefer he comes in and shares with us what exactly we are to learn. And yes, as usual, we do record our session. All have access to it later. We would want you to get to learn more. We would want you to share with a friend. So for today, we are pleading that, yes, usually we are full or almost getting to fill and full capacity by with 100 participants on our timeline. And we are just how many? 15. Oh, no. Please help us tell a friend to tell a friend that it's time for us to gather around the table and get to learn more. So I would want to leave the stage or the platform for Dr. Sam to help us understand what ocular allergies are. And he's going to help us delve into it deeper. And please, if you have any questions, concerns, comments, whatsoever, do feel free to write it in the chat box now, or you can wait when Dr. Sam is ready. That is, if you wouldn't forget, you can write down your question when he's done. The floor would be open to you to either ask or you can just type it in. So for those who would like to share, please, you can start putting down your comments, concerns, anything that you have concerning it today. So yes, Dr. Sam is here. Dr. Sam. Can you hear me, please?
Hello.
Good. Dr. Sam can hear
Please,
me.
can you hear me?
Yes, I can hear you loud and clear. Okay, so as usual, we have Josiah, our sign language interpreter, also, who is here to help us understand, or for those who have any hearing impairment, aside turning on the captions, you can also watch. So that's why we do this. We are for everyone. So Josiah is here to interpret for us to reach there are other hearing impaired brothers and sisters. So I would like to leave the floor for Dr. Sam as he has started sharing his screen, and then we take it on from there. Dr. Sam, please, your audience await you.
Good evening once again. So my name is David Sam, and I'm here to talk about ocular allergies. So before we start, I want you to know a little bit about the eye. That's the parts of the eye we are going to be talking about in general. That's the front section. So we will just take a bit of the front section. So if you should look at it, we have a part called the eyelid. We have another part called the sclera, which is the whitest part most people see, but membrane, which we call the conjunctiva. Okay. Then we also have the iris, the pupil. Okay. So let's get into the topic itself, which is ocular allergies. So ocular allergies or eye allergies or allergic conjunctivitis, one might ask what it is. It's a very common eye condition which occurs when the eye reacts to something that irritates it. That thing it reacts to, we call it an allergen. So if you should know the definition I placed there, I said it's an inflammation of the conjunctiva, that thin tissue I was talking about, due to an allergic or hypersensitivity reaction, which can be immediate or delayed to specific allergens. Okay. So what this is trying to say is that there are some things that your eyes would react to. Those things we'll get into them later down in the slides. But when this reaction happens, it leads to what we call an allergic reaction. This is mediated by a secretion from the mast cell. On the eyes, there are bits of different kinds of cells which lines your eye. They're always producing fluids, they're always producing proteins, so many things. So the mast cells there are responsible for secreting this enzyme we call histamine. the main precursor for allergic reaction. So when this histamine is released or when this histamine is secreted, what it causes is that it leaves the eyes getting red. You have some itching sensation, some swollen eyelids. So those are classical signs of an allergic reaction. Okay. So anybody can suffer from an allergic reaction, both young and old, anyone at any time, depending on what you're allergic to. So one might ask, what can one be allergic to that can cause a reaction like that? You can get allergies from so many things. Some like the fur from your dogs, your cats, from dust, from smoke, perfumes, pollens from flowers and trees and grasses. We can be allergic to so many things, a variety of things. So what allergies causes on the eye is redness. If you can take a look at this picture, the conjunctiva I was talking about, you can see it's inflamed. So what every redness is called an inflammation. It just means that the vessels, the blood vessels on the eye, are transferring a lot of blood to that sector of the eye, causing it to become more red, as you can see in this picture. Then it will follow with pain, a bit of pain. But for allergies, the pain is not, uh, how will I explain this? It's not a pain that you can say is a piercing kind of pain. It's more like a burning pain, a burning sensation. I don't know if many of us have cut onions before. In that instance where the juices of the onions get into the eye, we have that kind of stinging, burning sensation. That's the kind of sensation we are talking about. Then we can have discharges from the eye. Then another classic sign is tearing, or what we will call lacrimation. It's when the eye produces a lot of tears or keeps on secreting tears in order to wash away the allergen or the. Then we can have the eyelids getting swollen. I don't have a picture of that. I couldn't get one. So what it means is when the eyelids get swollen, there's an accumulation of fluid. So in your blood, there are so many, your blood contains so many things. There are platelets, there are white blood cells, red blood cells, and there are also a little bit of water in your blood. We call it the plasma. So when your tissue gets swollen, it's just an accumulation of that blood plasma over there. Then, so, okay, so I've already talked about this, the causes of it. So let's delve into a little bit more in the causes. So when an allergy is, sorry, coming. So let's delve a little bit more into the causes. An allergy is when the body's immune system reacts to an allergen, as I said previously. That is normally harmless. When an allergen comes in contact with your eye, it releases certain substances, which I stated before as the histamine. This reaction causes your eyes become red. It causes the itching, the watery sensation. So allergens can be found anywhere. Some are in the air, some are in your home. Sorry, excuse me. They can be found everywhere. Some are indoors, outdoors, everywhere. As I said, we have pollens, we have fur from dogs, the dandruff from pets, cats, we have dust mites, we have smoke, we have perfume, we have people who are allergic to other things like seafood. Some are also allergic to nuts. Some also allergic to some also allergic to smoke. Okay, so when some also allergic to cosmetic products. With the ladies, your mascara, the if someone can help me with those things the ladies use on their face. So we can have a slight allergic reaction to all those things. And even medications we are given, we can have an allergic reaction to it. So every medication has preservatives. So most allergies, when it comes to medications, it's not to the chemicals being used to treat the condition, but the preservative used in order to make sure that the medicine can stay on the shelf for a very long time. So when it happens that way, you have the reaction to it. So when it comes to diagnosing allergic reaction, that's where we come in. Okay, we have instruments which we use to examine the eye to ascertain whether it's an allergic reaction or a different condition. Since most eye conditions look similar, when you come to the eye clinic, you might be complaining of pain, redness, blurry vision. We might give you medication, but that doesn't mean it's specifically allergy because this is a common symptoms in so many eye conditions. You can have just symptoms I mentioned in a bacterial infection, in a viral infection. You can even have it when your pressures are very high or when you are having a foreign body embedded in your eye, which do happens a lot and most people know. So now we're going to talk about the types of allergies. There are many types of allergies out there, but we are going to limit ourselves to these four, which is the simple acute allergic conjunctivitis, the vernal keratoconjunctivitis, atopic keratoconjunctivitis, and the giant papillary keratoconjunctivitis. So I'll take it one by one and explain into details so that you understand and know how they appear and you get a little bit of an idea. So the first one we're going to take is the simple or acute allergic conjunctivitis. Okay, so this kind of conjunctivitis is allergic conjunctivitis is a very mild one. It's normally seen in toddlers, that's infants. Then it's a very short limiting inflammation. That means it doesn't stay long. It's just for a few days, then it goes off. That's when the allergen is no longer present. Then the eye returns to its normal state. So in that kind of situation, what you have in kids normally doing is you see them rubbing a lot. Okay, they'll be rubbing, they'll be itching, the eyes will be red, they'll be tearing. Then there'll also be some slight discharges, and you see them sneezing and having a lot of mucus coming from their nose. So when they come to the clinic, we have what we look out for. So in such a situation, their vision will be very fine. There'll be nothing wrong with their vision, but we will see the redness with the blood vessels I showed you in the previous picture. Okay. Everything else will look fine. There'll be some slight swollenness, some slight thrust on the eye, but in all that situation, everything will look fine. So the next one will be vernal keratoconjunctivitis. Okay. So this one, it happens more in children and in boys more.
Hello, Dr. Sam. Okay, so kindly bear with us as Dr. Sam's network tries to misbehave. He would be back soon so we can continue with our discussion. Okay, so unfortunately he's dropped off, but he would be joining us very soon. So do bear with us as he tries to reconnect.
Hello.
Yes, welcome back, Dr. Sam.
I went off.
Yes, please. So in your explanation of the first one, that was where we lost you.
Okay, then I'll take it from there again.
Thank you.
Okay, so okay, so back to the simple or acute keratoconjunctivitis. So as I was saying, this is a mild form of allergic reaction. It's found in infants, and it's a normal process they go through. Since their immune system is relatively new, they tend to react to so many things, which is normal. Their immune system is building up. So anything it sees, it takes it as a threat, and then it leads to the allergic reaction. So in this kind of condition, we have the child rubbing their eyes a lot. They'll complain as telling you that there's something on their eye. They feel as if there's something there, and they'll keep on rubbing. You see the eye become a bit red, like the picture I showed you. Then you see them tearing a lot. The eyes be producing so much tears, not trying to wash away the allergen from their eye so that that itching sensation, that feeling as if there's something on the eye, it goes away so the eye returns back to normal. So for this kind of simple allergic conjunctivitis, it can be either seasonal. If I say seasonal, I mean it comes with the changing of the seasons. In Africa, we have two seasons, the wet and the dry, but in Europe, where they have the four seasons, this kind of allergic reaction comes by when the flowers are in bloom. That is in spring and in summer, where there's a lot of pollen in the air, a lot of dust, lots of so let's use the pollen and the dust in the air. So they'll come with these classic symptoms. Then we, as the clinician, we examine, then we'll look at the eye, then we'll also see the symptoms. We'll also look and see if it's not because of a different infection. Okay, then we'll give the necessary medication. So apart from the seasonal, we can have another form of the acute or the simple allergic conjunctivitis as a perennial allergic conjunctivitis. Okay. So when we say perennial, it means year round. So for this kind of allergic conjunctivitis, it's always there. It's year round. It's never going. So for that patient, there are steps we take apart from the medication. We also advise the parents to get the child to a dermatologist so they can narrow down what the child is reacting to, then keep them away from that one. The best medicine is basically to keep them away. So for that, so for the next one, you have the venal conjunctivitis. So this is a reoccurring bilateral allergic conjunctivitis, and it tends to occur in males more than in females from the ages of 5 upwards. So studies have shown that this kind of allergic conjunctivitis, okay, is predominantly in the warm and dry climates, just like we have in Ghana. So when you come to the clinic, when we come to the clinical aspects, we have more kids or more boys with the venal conjunctivitis than the simple or the acute or the ones we will be discussing later. So with this one, we'll come with the classical signs, which is the itching, the tearing, the redness. But with this comes another form of sign the clinician will look at, which we see here in this picture. We call this frontal spot. So what this shows is just a accumulation of immune cells and other tissues which lay around the eyes. So we have a region, if you go back to the first slide, where I was showing you the parts of the eye. So when you look at the eye, if you look at the sclera, where it meets the iris, the blue part is shown here. That junction, we call it the limbus, the limbus. So you have the plantar spots around the limbus, so which is an accumulation of cells and all those antibodies which fight infection. So when you see this kind of sign there, that means the allergic conjunctivitis, which is the venal, has been there for a very long time, which has not been attended to, which has not been treated. So with kids who come in with this sign, there's another thing the clinician will see, and that will be a pigmentation. The sclera, the whitest part we're talking about, will no longer be white, would have changed color to a brownish tint. Okay. So with that one, most of the times when the eye color changes, there's not much we can do about that. But we can manage and make the cancer spot disappear, get the eye back to its normal states, that is without the allergic reaction, so that the patients can live a very comfortable life without constantly rubbing the eye. Okay. So these transfer spots also give the eye a sense of foreign body sensation, cause them to rub the eye more than they need to. So when we see this kind of condition, what we give the medication. We also, hello, please, can you hear me? Hello,
Yes,
please.
Dr. Sam, we can hear you. Well, I can hear you.
I saw my internet going unstable, so I thought it had disconnected again.
No, you're safe.
So for this kind of condition, for the foreign body sensation, as I was talking about, we will give medications to help alleviate the symptoms there. They could wash on their face, the water by moderately cold or somehow cold. This helps soothe the eye. Also helps wash away the allergen from the eye so that the patient will feel okay. So for the third one, we have atopic keratoconjunctivitis. This one is more in the adults. So the kids who had burnout and they grew up, they tend to have atopic keratoconjunctivitis. It's a very rare form of allergic conjunctivitis, which affects both eyes. Okay. And it develops from adults with people with a long history of atopic dermatitis, which is eczema. We all know the patches on the skin, which reaction. So with that one, if you have some on your skin, I'll advise that you see a dermatologist used to help soothe the reaction and get your skin back to normal. So for this one, there's symptoms that are almost the same as in the ones with the VKC. But with the clinician, we'll see like, for with the clinician, when we look at the eye, we'll see some more of a scarring. I didn't want to scare people with some of the images, so we'll see more of a scarring on the cornea. We call that an ulceration, which can lead to a scar, which can impact vision in a very bad way. So we will come to the next type of allergic conjunctivitis, which is the giant papillary conjunctivitis. Okay, so with this one, is it's a more of a secondary allergic reaction. So you're not reacting to something per se, but for people with contact lens, prosthetic eye, so when they have that thing on the eye, they're not reacting to it. Sometimes you can't react to your contact lens. That's not the lens itself, but the solution in which you keep the lens. But for this kind of allergic conjunctivitis, when they have the contact lens on the eye for a very long time, there will be an accumulation of new cells, protein, and all those things on the surface of the lens, which will cause a reaction where the eye dries, causing an appearance of what we call a cobblestone appearance of the eyelid, if you can see in this picture. So for a normal one, there are not supposed to be any bumps of contact lens. And also this, we call them papillae. So this also can be another sign of infection. So when we see this, we ask a series of questions in order to rule out it's been an allergy or an infection. But with the allergy, as I said, you know the classical signs. You have the itching, the redness. You have the slight sensitivity to light. You have some slight discharges, not copious amounts of discharges. When I say copious, I mean a lot of discharges. You have some discharges, not too much. Okay. Then with this kind of allergic reaction to people tend to have sensitivity to their contact lens. They do not want it on their eye anymore. They tend to throw it away because they don't feel comfortable with it anymore. So for these people, what we normally do for them, apart from the medications we give them an ocular lubricant. When I say that, I mean artificial tears. So they apply on their eye so that it suits the eye. It also serves as a way of creating, taking away friction. I don't know if a lot of people understand what friction is. So when we say friction, the best explanation I can give is what keeps your car on the road. The force that keeps your tire on the road and doesn't let you fly over it. So the same way, we are taking away friction from the eye so that when you bend, there will be effortless up and down, not as jagged up and down where you have these kind of patterns then. So, okay, then we'll come to treatment. Mm. So, as I was saying, when it comes to the treatment of allergic conjunctivitis, the best method is to stay away from what is causing, finding out and staying away from what is causing the reaction. If you if we do find out what's causing a reaction, let's say dust or pollen, then the second best method for you would be to get an eye protective wear. For our, for us in Ghana, yeah, I don't think you can go 5 minutes outside without encountering dust. You pass here, there's dust. You pass there, there's dust. So for people like that, we encourage them to get some protection, be it sunglasses, be it prescribed lenses, so that it limits the amount of dust getting on their eye, hence cutting down the allergic reaction without the need for constant medication being dropped on the eye. Okay. So another one too, you can have your children stay indoors more, especially if the person suffering from the allergic reaction is a kid. You have them stay indoors more so that they don't get in contact with the allergen. Then you can also adopt this method of thoroughly cleaning your house. When I mean thoroughly cleaning, and if you take a rag, you wet it, you clean the surfaces, making sure that the dust and the pollens do not find themselves on the surface, because once they find themselves on the surface and the kid touches it and immediately touches the eye, they would have that reaction. So for people who also suffer allergic reaction from their dogs and cats, you tell them to do away with those pets, stay away from them, so that they limit the amount of reaction they get. So when it comes to the drugs and the medications we give, so we, as I said, we can give you artificial tears, which is a tear substitute. When we say a tear substitute, sorry, a tear substitute, we mean your eyes are producing tears, but not in the right amount or not in the correct quantity. So we give you artificial tears to supplement. But in the case of allergic reaction, the eyes are producing enough tears. Just that the allergen finding itself on the eye, your eyes will keep on producing tears in order to wash it away. So we help in that sense by giving artificial tears in order to prevent the allergen from falling on the eye and causing the irritation. So we have many kinds of artificial tears on the market. I'm sure most of you, when you come around, they give you some Ocular, some lives. They are all different types of artificial tears, and they all serve the same purpose. Okay. Then the next is topical antihistamine or mast cell stabilizers. So if you remember from the initial slide, when I was explaining the causes of allergies, that is the biological process that goes on, we said there's a secretion of histamine by the mast cells. And this leads to the itching, the redness, which is the classical signs of allergic conjunctivitis. So when we give you a topical antihistamine, what we are trying to do is when the histamine is secreted, these drugs will rather attack the histamine, causing to be less on the eye, which will also lead to less of the symptoms. And also when we give you a mast cell stabilizer, the same process, the drop, the medications in the drop will cause this mast cell not to be producing the histamine. So an example of these drugs, should I give you examples of these drugs? Maybe you let me see. So we can have something like for the mast cell stabilizers, we can have something like sodium chromolylates. On the market, you see them as epichrome. They all have that from them. So if you see them on the market, you know that they are mast cell stabilizers. For the topical antihistamine, we have that's like packaging. So when you come and the doctor gives you something like sodium chromolylates or packaging with whatever dosage you see uses in, all he's trying to say that we have an allergic reaction. So he's trying to limit either the
It looks like the network doesn't want to favor us today. So unfortunately, Dr. Sam's line keeps getting cut. However, he's here with us, so he would reshare his screen so we continue the conversation. So kindly bear with us as we work around this. It looks like the network doesn't want to favor us today.
hello, Madam Ida.
Yes, we can hear you.
Oh, okay. I'll continue. So please, if someone can tell me where I end, I'll continue from there.
Yes, Dr. Sam. So you were
Yes, we can hear you.
okay. I don't know why I keep getting a repeat of what was last said.
If someone can tell me where I end,
Godi,
I'll continue from there.
please, is everything okay? Yes, Dr. Sam. So okay, hello.
Yes, please. I can hear you now.
Okay, sorry about that. I think I went to our YouTube page, and as a result, I kept hearing myself, and I was wondering what was happening. Do pardon me for that error. So you were mentioning some medications that are used to help in the condition whenever we get to the clinic or a medical facility.
Okay, please. Please, can you hear me?
Yes, Dr. Sam, please go ahead.
Okay, so I will start over again with the treatment. As I was saying, when
Thank
it
you.
comes to treatments, we can give artificial tears. That's tear supplements. Okay, so in the instance where your eyes are not producing too much tears, we give you these drugs. But for the allergic reaction, when I said the classical signs were tearing, we mean you produce so much tears, but we give you this to help wash away the allergy so that your system doesn't keep on producing the tears. So some of the drugs we give are the oculars, the cool lights. The dosage will depend on the person prescribing it, but mostly we give it 4 times a day. Giving it 4 times, that it will help wash away the allergen. Okay. Then we came to the topical antihistamine and the mast cells. Although we can give them topical, we also have orals where we give you the antihistamine to take. Those ones are a bit tricky. They tend to cause drowsiness, so we like giving them at night. But with the topical, we can give you, depending on the dosage, some will give it 3 times, some will give it 4 times, depending on the severity of the condition. So as I was saying, you can have some of them being sodium chemoglycate or the pacadol. So all of this, the main purpose of these drugs is to limit the amount of histamine in your tears or the amount of histamine being produced by the mast cell in response to the allergy. Then another one we can give is the steroids or the corticosteroids. These are anti-inflammatory drugs. So what they do is that they limit the amount of inflammation going on in your eye by dying down the inflammatory mediators. Their cells is one responsible for causing inflammation. So these medications just bring them down so that you do not have the classical sign of inflammation, which is the redness, the pain, the heat. All those are also classical signs of inflammation. So with the steroids, for the kids, we tend not to give them steroids because they are apart from the contraindications, there are side effects with prolonged use of this kind of medication. One of the side effects of prolonged use of steroids is the increase in intraocular pressure, which can also lead to a condition we call glaucoma, where the nerves at the back of the eye die out due to high pressure, which next time, if God willing, in our next parents now people, I might discuss glaucoma, where we'll talk more about this one. So we tend to give kids the corticosteroids more, since it doesn't have so much side effects on the steroids. So this will help bring the redness down, the slight pain. It also helps with it also helps in case of severe allergic reaction or more of the chronic ones. And it also really helps in the vena. If you can remember the picture I showed you about the counter spots, where you have some ring-like projection around the eye. So in cases like this, we need to give the corticosteroids to help bring down the inflammation going on. There are other forms too I was talking about. I didn't add to it was the immunotherapy shots. So with this one, it works on the principle of build up. If you played this field before, where someone keeps on ingesting small amounts of poison just to build up immunity or tolerance to that kind of person. So with that, we just introduce a little amount of the allergen into your system so that your system gets used to it and stop reacting to those kind of allergens. So with that, it brings us to the end of our topic, which is ocular allergies. So if there's any other questions, I can answer them.
Okay, that has been a lot, I must say. And Dr. Sam, thank you so, so much for everything till now. Today I have to say I've been in a classroom. I have been in a consulting room in addition. I've moved around. I don't know how you feel for others on the call, but that's how I am feeling currently. What about you? How are you feeling? What have you learned? What have you gathered? What are your questions? What are your concerns? What are your comments? Please, now is the time to bring them on board. And for my friend who was asking me, what is that concerning the topic ocular allergies? I know she is here. I can see her. I wouldn't put her on the spot. So now I am hoping she gets to tell me what she has learned out of this whole learning um encounter she's had so far. So yes, if you have any questions, any comments, any concerns, please do write them in the chat box or just put up your hand and you would be called to share whatever you want to share with us. And as earlier mentioned, we are streaming on our Facebook, no, not the Facebook, the YouTube. So we are streaming on our YouTube channel, Parents Roundtable, with the topic ocular 2025 with the topic ocular allergies attached to it. So even if you missed or someone you know missed it for today, you can share the link or you can tell them. And when we are done, we're going to post it on our community page for everyone to have access to it. So whether our viewers on our YouTube channel or those who are here, please, if you don't have any questions, comments, concerns whatsoever, I would put someone on the spot and then ask the person a question. If not, then it tells me that Dr. Sam has really addressed everything, in addition to giving us medications and all that. So today, dear, I'm sorted in every area. What do you have to share with us, please? And I am glad that Dr. Sam has agreed to join us again for another session on glaucoma. Although our schedule for this year has been made, I am glad he committed himself. So let me say, Dr. Sam, thank you so much for committing yourself. I know I'll fall back on this promise later. So don't mind me when I come.
Okay, don't worry.
Thank you. I am glad. So yes, Sister Ikuya, I know you are here and I know you've listened. Please, are all your questions, concerns, and comments answered concerning ocular allergies? What did you also learn about these allergies? Is there anything you would like to share with us? Please go ahead and feel free and share with us. I can see quite a number of people here who have joined us on the call, and I would like to say a big thank you to them for joining us, for taking at least we are about to spend an hour into our discussion. And I am glad you've taken the time to be with us today. Thank you for making the time. Josiah, who has always been helping us also with our sign language interpretations, we are grateful to you also, Josiah. Thank you so much. Hey, for once, I don't have anyone having to raise a comment, concern, or question. Let me check on YouTube. Oh, okay. Hey. Am I not happy when I get to have an audience that understand whatever has been shared? So then we're going to do this in like 5 minutes. So we see how best we can end early. Please share with us in just a sentence. If you'd like to write more, go ahead. But in a sentence, tell us what you have learned in the chat box, or you can just put up your hand and share with us, please. Our time starts now. Don't mind me. I like putting people on the spot, but so let's see you type out what you have personally learned also. Please share with us. Any takeaways? That's all I want for today. In a sentence, please share. Whom are we going to hear from first? Edinam, I know you're here. What did you pick? What did you learn? Please share with us. Eddie, would you like to, can you unmute? If you can't unmute, then you can just raise your hand or type if you want. That is if you can't unmute, please.
Yes, hello, Ida.
Hi, Eddie. Please
Good
go
evening,
on.
everyone. Okay, so I wasn't able to join from the beginning, but from the little I heard the part about dust settling in rooms and different spaces and how that can affect kids. And I was just thinking about how sometimes, like because of our um weather changes and all that, we might take some of those things for granted. And so, even though we see that as part of our everyday life, those little things can go a long way to affect our kids. So, that's my takeaway from the session today.
And I'm sorry, I think I also went in my end also. So at my end also. Hello? Okay, Josiah, can you hear me?
Yes, I can hear you.
And he tells me he can hear me. Am I audible?
Yes.
Okay. All right. So technical glitch. For once, I'm going to close early because I'm not having anything. Oh, Godi, is there anything I have missed, please?
And there was someone who placed a question that where their child has weak reoccurring allergic conjunctivitis, allergies. So for cases like that, I was saying you would need to find out what they are reacting to. What exactly is the child reacting to? It takes a while, but if you have time, if you have the resource, you can go and see a dermatologist. As I was saying, they have allergic toolkits where they expose the child to some known form of allergies. See if they will react to that allergen. So if they react to this, then you know that it is this they are reacting to. So in that case, you let the child stay away from that kind of allergen. Since they are children and we are not around them 24/7, you don't know what happens when they go outside to them, they are going to speak for you. In that case, you also come the school authority so that they will know that, oh, my child is allergic to this, that, and that. So if you could help me by keeping him away from those things so that he doesn't have that kind of reaction. But if it keeps on reoccurring and you don't know what it is, as I said, the best thing is the medication so that we help bring down the symptoms so that they can have a normal life without always rubbing the eye. I hope
Nice
I'll be
one.
able to answer them.
I think that is helpful. So then one thing I have learned from this is that it will take some time for you to get to know what exactly the issue may be. And as Dr. Sam earlier mentioned, Sarah, she says thank you. So I think Dr. Sam, you've been helpful to her. Okay. Now I am getting to see some things here. So Sarah's own has been answered. Ama Echampon says that continuous use of steroids can cause glaucoma. And then Sarah says, thank you. Okay. So I have now seen my questions I was missing and then the comments I was missing. That is what Amma has learned. Amma, thank you for sharing what you've learned. Please, if you have any other thing that you've also learned, you can share with us also. And as I was saying, it takes time to get to know what a probable allergy may be. You may need to do an inquiry, see a dermatologist, just as Dr. Sam has earlier mentioned. We may need to take a lot of time, research, all these things come into play. However, it is essential that we get to know and understand what exactly the issue may be. And in trying to understand what the issue may be, please do not be in a rush. If your medical personnel tells you that you need to do this A, B, and C, do not say I have done this and then that is the end. Please stick to whatever plan that has been given to you. Follow through whatever pattern that has been mentioned to you. Let whatever thing they've told you guide you, but be an observer. Be a diligent one. Take note of things that you're saying. If possible, you can keep a track note of whatever it is, whether on your phone or you can write it down somewhere. So when you get to the medical facility, you can show them that, okay, so these are the things I observed as to when my child came in contact with this and that happened, or that and that happened. So it also serves as a means of helping the medical personnel learn exactly what the possible challenges may be. All in all, I have shared what I have learned. Amma has also shared what she has learned. Eddie has shared what she has also learned. Would anyone want to share what they have also learned so that at least we can get to hear and learn from you too what you've gathered on ocular allergies? And as I bring the meeting to a close in some few minutes, I can say a very big thank you to everyone who has been a part of this. Yes, on the fourth Sunday of every month, we bring something new to you. We help you get to learn something, and that has been our objective and as part of our CSR that we do, our corporate social responsibility. We would want to let the public get in touch with the personnel who can help them with certain concerns or anything. And as I always say, you have a free consult with the personnel we bring, because if you are to see Dr. Sam, yes, you would pay for consultation and all that. But fortunately, he's been here to give us a whole lot that's I can't think about. All in all, thank you so much for being a part of this evening's webinar. Thank you for sharing your thoughts, your comments, your question that you had. Thank you, Dr. Sam, for availing yourself for us this evening. And next month, we would be discussing things about nutrition. It's going to be our nutrition month. So yes, our dietitians would be here to help us understand everything concerning nutrition. Do you have any questions concerning diets, weights, whatever you have concerning nutrition? Please start preparing yourself for it, because we're going to help you get to learn more. And we do need you to also tell someone about it, so we all get to learn from each other. Thank you all for making the time to be with us this evening. The link, as earlier mentioned, is on our Parents Roundtable on YouTube, but we would share it on our community page also, so you can be a part of it. So please share it as wide as possible.